Hi, I'm AJ Debonis, and welcome to Interfaith Matters. As we continue to examine the impact of the COVID-19 pandemic, this episode brings together three faith-based activists and service providers to discuss the disturbing rise of domestic violence during the pandemic and the plight of victims who are at a higher risk due to social isolation and stay-at-home orders. For those who aren't safer in their own home, the pandemic has created a worst-case scenario where options are limited. An average of 115 New Yorkers have visited the city government's domestic violence resource website each day since the start of the pandemic, a staggering increase from the usual daily average of 45, and similar trends have been noted around the globe. As our guests make clear, this isn't a new problem. Like so many underlying systemic issues that have intensified in the last month, such as racial and class disparities in the pandemic's death toll, the pre-existing threat of domestic violence has only been exacerbated by COVID-19 and has become a public health issue in its own right. This episode explores the risks victims and survivors face in these challenging times, as well as ways that faith leaders can support them. Our guests are the Reverend Dr. Sally McNichol, Co-Executive Director of Connect, an organization that works with New York City communities to prevent domestic violence, Anandita Chatterjee-Baumik, a certified trauma professional, licensed independent clinical social worker, and director of Boston Evening Therapy Associates, and Robina Niaz, the founder and executive director of Turning Point for Women and Families. As a note to listeners, our guests discuss topics that might be difficult for some members of our audience to hear. We're talking about the potential rise of domestic and intimate partner violence during the time of the coronavirus. And just from your own perspectives and what you've been dealing with in the past couple of weeks, have you seen evidence of an increase in domestic and intimate partner violence in the communities that you work with over the past month?
Yes, absolutely. It's just been less than a month since the shutdown, and even before the shutdown happened, I was concerned about this because we know, those of us who know in the area, work in the area of domestic violence, know that isolation is a very powerful tool in the hands of the abusers, and they intentionally isolate their victims from their support networks, family, friends, and all. And now, when the whole city shuts down, they are completely isolated and they are in more danger than they were ever before. In the last month, we have seen an increase of at least 33% more calls from survivors. What we've also noticed is that the survivors who are living by themselves without the abusers at home are calling more frequently. And we have stopped getting calls from women who are living with the abusers because now the abusers are at home and they're monitoring every move. It is playing havoc in the lives of children and women, especially some of the women had just reached a point where they had started a job, or they had just found a job after a couple of years of getting trained, and we were working with them, and then suddenly this happened, and they have no means of income, and paid 1 month's rent and don't know what's going to happen next. And so there are stories galore.
I will address it from two different perspectives. So in Massachusetts, we have seen an incredible rise in the domestic violence incidences. However, the calls have been less. So to the point that the state officials got concerned, and they're saying that the calls are coming in less. And so they established a hot, safe link that women can call, and they have been talking about it because, we are concerned. Now, personally, I have had to refer people out to couple different organizations, and they're excellent organizations. Jimmy Geiger Crisis Center, Reach, Respond, they're all great organizations. And the thing is, I am recommending people to go and contact them. However, I am not 100% sure that And they are able to do that because if the batterer or the abuser is home, they're not going to call the hotline. They're not going to call the service providers. Originally, what would happen, they would go out to a friend's house, they would go to their relative's home, and they would make a phone call. They're not going to call while the abuser is in the other room or in the same room. So it is really, really difficult. And wherever possible, I have mentioned that they leave the house if they safely can and go to a relative's home to find safety. But I have to acknowledge that it is incredibly hard. And as we all know, it gets worse for a victim survivor when they make an attempt to leave a batterer. So we have to also bear that in mind, that it may be dangerous for them to leave a hostile situation.
Yeah. And just to add to that, I think it's expanded and it's deepened. Just the way Rabina was speaking about the isolation, and the power and control. This gives a person who wants to control their partner more time, more tools to control. So we've heard stories of threatening, if you don't do what I want, I'm throwing you out and you're going to get the virus and you'll have nowhere to go. Or you have to wash and wash and wash all day long. Somebody who had, hands that were bloodied. So it's just deepened, and we are in touch with some people who are in the same place as the abuser, the person who's abusing. And every once in a while, like we've been having calls at 3 a.m. with a few people who can call when the kids are asleep and he might be asleep. And I actually just got a call from the Interfaith Public Health Network in New York, and they were calling to talk about substance abuse increasing, which we know doesn't cause intimate partner violence, but it exacerbates it. So and as you know, the liquor stores are open because they're considered essential. And so are the gun shops open because they're considered essential. So that increases the likelihood of disaster a lot.
You all mentioned, isolation, of course, is a reason that we seem to be seeing an uptick in reported abuse. Are there other reasons that this kind of violence is increasing during the pandemic? I'm thinking particularly of perhaps economic difficulties on behalf of abusers. And I wonder if you could, without violating any of your clients' privacy, are there specific examples that you could share that illustrate the connection between the pandemic and domestic or intimate partner violence that you've seen in the past few weeks?
I think going back to what Sally and Anvita just said, we know that at the base of the issue of domestic violence, is the need for the abuser to exercise power and control, right? And this is fertile ground. This is the perfect way he can do it, where the woman can't go out. Normally a lot of the women who are living with abusers would come to us for counseling when they drop their children off to school. Yeah. And then on the pretext of going grocery shopping or something, they'd come and have their weekly session with us, or they'd come to the support group. Now we're doing the support group virtually. There's no way they can participate. We're doing phone counseling. There's no way, if they are living with the abuser, they can participate. And one of my staff just shared a story of a family, 2 children, mom, and the abuser all living in the same home. And while she's saying that he hasn't been violent yet, that all 3 of them are walking on eggshells in their home. They are scared to breathe. They are scared to say a word. They're all keeping their phones on. So if he gets violent, because he has been violent in the past, but he used to also be out of the house or go to his home country for several months in a row, and they would be breathing easy during that time. Now he's literally there breathing down their throats, and they're living in their own, we're feeling safe inside the four walls of our homes, right? These are women and children who are feeling most in danger when they're in their homes, because the abuser is right there. And who knows what he'll do next. And yes, we can talk to them about calling 911 or seeking help. And it's hard for people to understand that some of them are maybe living, these are working class people who may be living in just one bedroom, right? And they have one common living area. Where are they going to go? Where are they going to seek help from? So we have been reaching out to all our clients to find out if they need money for rent, if they need money for food. We have a lot of charitable organizations in the Muslim community in New York City doing fabulous work. They're literally dropping groceries to people's doorsteps. And they reached out to me and they said, "Sister, we can help your clients." I said, "No, we can't give you their names. We can't give you their addresses. We don't know if it's safe for you to even go to the doorstep, put the food over." So some of the women who were comfortable, we sent them financial assistance so that they can go and buy their food when it's safe for them. But there's so much going on with the abusers living at home, but also those who are, some of them are living with their elderly mothers, right? And they were caretakers for their mothers, as well as going out earning money to put food on the table. And so there are all kinds of these, there were fears enough to do that. And I keep saying that this pandemic has actually laid bare the vulnerabilities and the systemic problems in the way we respond to domestic violence as an issue in this country. And this was really came as an afterthought, basically. No one was talking about domestic violence. And I kept raising the issue, and then we find out that in France, it has gone up by 30%, and in other countries, it's spiked. And I said, how is it possible that it's not happening over here? It's happening right in our midst. And just last week, we had a webinar with CARE, and we had an attorney who was talking about women's rights and telling them what to do, and they can still get an order of protection, and they can still call and email and all of those things. It's so important that we get all this information out to women so that at least we know we are doing the best that we can. I know that there's no way we can ensure that each one of them is going to be safe, but are we doing our best to make that happen? That is what keeps me awake every night.
Actually, there are a couple of parts to it. What you were saying, AJ, what Rubina is basically saying, some of these women were also earning a substantial amount of money, and now that is not happening. And so now the batterers are also taking out their own wrath on these poor women because they're not being able to bring in the money. And also you have to remember the economic struggles are very real for a lot of Americans right now. It's not just the immigrant community or minority communities. It is a reality for many, many people. However, what is happening in these particular situations where there is an imbalance of power, where there is power and control, the women are being seen and scapegoated for their economic crises as well. And the sad part is, they're also being blamed for having too many children as if they produced them by themselves. These are all realities, and, so this only exacerbates whatever was already there. And now these poor women do not even have any respite. They cannot go to the mosque. They cannot go to the temple. They cannot go to the church. They cannot seek help. They cannot do anything. They're pretty much stuck in a place. And what Rubina was saying, it is so true. They are telling us, like, they really cannot breathe loud enough so that, they're going to disturb somebody else's sleep. If the kids are making noise because the kids are home, so the kids are going to run and play around, and that is bothering the batterers, and they are getting mad, and they are taking out their wrath on the mothers because they are now being negligent and they cannot control the kids. So it's just like, do your damn for every single thing that they are trying to do, that they are getting pummeled by the batterers. It is, and in total isolation. There is nobody that can help. I wouldn't call people, just like Rubina was saying, some of the temples over here are dropping off like, food and stuff. But then again, when you're going to drop off the food, the patterers are generally there, if at all, right? So if you're going to any space, unless and until it is safe for us to reach out and specifically talk to the woman, which Rubina might have, some access to, or Sally might have access to, unless you have specific access and it is safe for you to reach out, how are you even reaching out to these women?
And I wanted to go back to something that Rubina was talking about, the family, like so many families that are tiptoeing and they're scared all the time. And, that lowers your immune system's strength, that kind of constant stress. So then you've got a situation where people's immune systems are even more weakened and they're more vulnerable to the virus. And I think that's an important thing to remember. And also, we talk in the domestic violence world about something called gaslighting, right?
Yes.
And the fact that there's so much misinformation, like that's happening to us on a pandemic level in terms of information we're getting from our federal government, contradicting, all this contradicting misinformation is happening there. And that's actually happening too, where an abusive person is giving misinformation, passing that along, using that to say, oh, if you do that, this is what's going to happen. And you're doing this to the children. And I read that this is going to cause, so I think it's important to realize that the unfortunate and abusive parts of the systemic larger context that just, that we see so magnified now by the virus, that's all the things that were going on before are magnified in the household also. So it's really
the stress is exacerbated. There is a collective depression. There is a collective anxiety. There is a collective grieving that we are all party to. So there is these things that is happening all around us. And on top of that, imagine you not being able to share that you're feeling some sort of way. And anyways, this is another name that is so frequently applied to like you're crazy. And, that is part of the gaslighting, right? And you're crazy is something that she's told often and frequently. And now, even if she's feeling some sort of way, even if she's feeling depressed, even if she's anxious, oh, you're crazy, that is going to be labeled against her, so much so that she will not have any respite, to be honest with you. And the threat of being a bad parent, and the threat, this is also, I'm noticing in cases of separated parents, right? So the father is going to come back and say, you're a horrible caretaker, you're not really protecting the kid, you're not doing this, and God forbid the person has a mental health condition. This then becomes a hotbed for the batterer to come and claim custody or take the kid away from the mother, alleging neglect. And so this is all on the rise.
The co-parenting and custody issues are just a nightmare. And, you can't get any orders from family court unless they decide it's an emergency. And in New York City, anyway, what they decide is an emergency is usually an abduction. It's not when a mother comes to say, I'm concerned that my children are seeing this abuse and I can't have them going to their other parent. That's just one example, but it's a huge issue right now.
It's a major, major issue. And what is also happening, they're looking for any little, any minute infraction on the part of the custodial mother to go back and make that a case. And once you file and take the kid away, given the fact that we know we are in the middle of this pandemic, so the cases are not being heard. Most family courts or courts that hear, custody visitation cases are not really hearing cases right now. They're postponing it unless it is absolutely an emergency. So now I have custody of my child, and then, adjudication or hearing will be postponed for 2 months, 3 months, and now the mother keeps on suffering because now the kid is now taken from her, and this kid has never ever had stayed a day apart from the mother or the caregiver. So it is incredibly difficult.
If I can just underscore one more issue is the one of domestic violence shelters,
Yes.
which are
Yes.
woefully under-resourced, and we don't have enough space in shelters. Even before the pandemic broke out, right? Women couldn't get into shelters, or if they did, then they were all not equipped, especially women of faith, right? I'm talking on behalf of the Muslim community, where a Muslim woman would go to a shelter and run back to the abuser 3 days later because nobody understood why she needs to have halal food.
Exactly.
Or why, even if she's cooking vegetarian food, why can't she cook it in the same pan in which pork and ham was cooked, right? Those issues were already there. And now with this pandemic and in the shelter setup, they're all living in very close quarters. There's a lot of proximity. And even though we hear that the shelters are doing all they can to maintain social distancing, I don't know how it's even possible to do that, right? And so women, even think of it, somebody who happens to be in an emergency and gets to call 911 and gets to leave the abuser, then where is she going to go next, right? If that is what is waiting for her, think of her situation with children, not knowing, and the ones who are with the abusers know the reality at the shelters. And so at this time, they are not going to even make an attempt. One, that they are in way more danger, far more danger when they're trying to leave the abuser,
Exactly.
even when there was no pandemic or anything, right? In the current circumstances, it's so much more difficult. And then if they manage to do that, friends and relatives and families, I haven't seen anybody in the last 10 days. I haven't stepped out of my apartment. Who is going to open their doors to them? And where are they going to go, right? So these issues were already there, and those of us who advocate on behalf of survivors and victims of domestic violence for years have been talking about this. And here we are faced with a global pandemic and woefully ill-equipped. It's not just the hospitals and the medical setup and everything that has exposed the US to the entire world. It's this as well. But this has been there always.
Always.
Even when things were good for everybody else, they were never good for survivors of domestic violence or victims of domestic violence.
And even if the mother or the father or the sister or the brother is willing to take a survivor in, it's not safe, because then the batterer knows exactly where to find them. So that is never a safe haven when somebody is fleeing an active, acute domestic violence situation. They need to go to a shelter. They need to go to a place which is not disclosed to the batterer for their own safety. And what Rubina is talking about, I, as an advocate working in New York City, dealing with my people, I have been through that, and I can testify to the fact I would hide cans under my desk so that I could give it to people who had food restrictions, so because of the same reason that they could not eat the food that was offered half the time in the shelters, not because it was ill-intentioned, but they were not ready and they were not prepared. I'm not going to say that people did it intentionally, but they just did not have the education, or they did not have the resources, whatever have you. Having said that, now that, we are talking about shelters, and we are talking about people opening their doors and all kinds of stuff. We also have to remember that some of the batterers are really, really keen on taking revenge. And so just going to your relative's home is not an answer. And yes, we need more shelters. And yes, we need to make it more more friendly for the diverse population that we are. New York is a very diverse state and city. So is Boston, so is Massachusetts, so is entire America. We just cannot have one type of shelter for one type of people and call it a day. We have to keep in mind the differences that, we bring to the table, and we have to accept people. And another thing that I have very recently experienced, people are still unwilling to leave their pets when they are in domestic violence situations. They do not want to leave their pets. And I know some of the shelters have now become pet friendly, but we know A, shelter pets are scarce. B, how many shelter places are willing to take anybody with a child? Forget about a male child who is a little bit older. And now we have a pet involved in that situation. Where are we sending these people?
And then there's a whole other layer of people, of survivors who before this were never going to leave. Mm-hmm. They didn't feel safe leaving because of ICE, because of this particular, shelter situation, but also because that wasn't their choice. And we've been working with quite a few of those women, and all the safety that they'd built up during this time, which really counts on, I can walk over here, I can go to my library empowerment group, people have very elaborate ways of staying safe in bad situations, but many of those, the moorings of their safety have been taken away by this shelter in place. I find that so ironic that it's called shelter in place,
Yes.
So they don't even have the capacity to call the friend or call Anandita or Rabina or me, or they have a whole new, like all of us, it's just like the rug's pulled out. Everything is different now. You have to move in the world, or you can't move in the world, but everything is just completely disrupted. So the safety they had before isn't there now. And then the other group, which Rabina mentioned, are people who have survived and they're okay and they're beyond, but their trauma, their memory of the isolation, their memory of the gaslighting, their fear, just the fear in their cells is activated, and they need support too.
What happened to many of the clients that we were working with, some of them thought they were ready to move on, or they stopped coming 6 months ago, or a year ago, or even 2 years ago, suddenly have started calling us back again and again. Why? Because Turning Point was there for them when they needed the support and they needed advocacy and all of those things. And when this is triggering a lot of trauma for them again and they feel the need to reach out and connect with somebody who was there for them when they were going through a crisis. And this is a crisis that's kind of activated that trauma and the fear that now they're by themselves again. Where do they go? That is another group of women who've started calling us. We haven't seen them in months. We haven't talked to them. And what is happening is this trauma is being triggered and they're feeling re-traumatized. They thought they were at a good place and they were managing until this happened.
And one other thing that I was reminded, I was fortunately and unfortunately working in New York City after 9/11 when everything happened. And, and we are seeing something eerily similar right now, because right after 9/11, there was this anger and frustration towards immigrants. So everybody was at risk who looked different, to be honest with you. I had a victim survivor who was just coming to see me, and somebody just decided that somebody is going to just do something obscene, like, spit at my person, So it so happened. And then one day when I was talking to her about leaving the batterer, she just looked at me and she said to me, she used to call me Baji, older sister. And she said to me, "You're asking me to choose between two oppressors, Baji, one at home and one outside. That one outside is unfamiliar and much more powerful, and they do not like us. So you tell me which one am I going to choose?" I will never forget that. And I'm reliving that every single day, because I feel as immigrants, all of us are at risk, because there has been a very angry backlash meted out towards, Asian communities. And, I don't think we feel safe when this is the scenario, and every one of us, who look different are going to be targeted by a section of the community. So how come, then again, I think about my person even till today, like, who am I going to ask them to choose, the oppressor at home or the bigger oppressor outside?
I'd like to jump in there just because I think it's an interesting point to get at who victims first kind of come to for support. And I wonder, you all come from very diverse religious traditions. Do you find that faith leaders are equipped to handle cases of abuse when victims come to them first? And have you seen any change in this pattern as faith communities have shifted to having to kind of be a presence online? Are those outlets still there? And are faith leaders able to help in these situations? Or specifically, what do you think faith leaders or communities could be doing right now to help?
They are, I'm looking at a lot of online stuff going on, so much so that the afternoon prayers the sermon is being held online, and people are praying virtually in their own homes, but listening to the sermon. A lot of religious leaders have stepped up, and they're doing podcasts every night, and they're asking, people are joining in to pray together collectively and all of those things. I am not sure if a lot of women are reaching out to them individually to see how they can be helped. Again, what needs to happen is for a lot of faith leaders, most of them are men, need to be aware and very, very sensitive to this situation. And most of them are very well-meaning people. Like I said, somebody called me and said, "Sister, let me know how many bags of groceries I can deliver to your clients," right? And I had to pause and say, "I thank you for thinking of us, but this is not how we can do it," right? The confidentiality issue, the isolation issue, the danger, being in a more dangerous situation. And think of it, how are the women then, unless the abuser is not at home, going to call the religious leaders? At this time, what faith leaders are doing, they are reminding us to pray. And we are praying like we've never prayed before. But when a woman is completely isolated, I think of them every day, that it has been 3 weeks that my movements have been so badly restricted, right? I haven't gone out to go buy groceries for the last 9-10 days. And this is just these 10 days. How are women living through that for an extended period of time, traumatized, in fear? I'm at least not fearful in my own home. And so I think a lot of our faith leaders need to step up and reach out and put out special messages without any of us reminding them that this needs to happen. We're talking about the most vulnerable in our communities. And where I go to, attend a lot of events, and I hear a lot of Muslim leaders talking about the violation of our civil rights, right? When the Muslim ban happened and all of that. And I said, when it is, the forces are from the outside that are attacking us, we all band together and we are all gung-ho and we are fighting and we are screaming and we are pushing back. I said, as Muslims, it is our duty to do the same thing when it's happening to somebody in her own home, when her children are in danger, right? That is the time, and we have to seek out the most vulnerable.
Thinking about the faith leaders too, also, they do have, through the Zoom and their online activities, they do have probably more people listening.
Yes.
And they do have the influence, the moral influence to actually address this issue. And in addition to reaching out to perhaps the women in their faith community, I think it would be amazing if they reached out to the men and said, because we do quite a bit of work with men at Connect, and we've had a flood of men coming to our men's roundtables, because many of the men are just lost. Like, I've lost control of my whole life, so who am I going to control? And that's going to be the family. And I think that faith leaders, the important thing really though, and this is another one of those things that before and after are not really different, I mean after the virus, but faith leaders who understand the dynamics, who understand the power and control and the different tactics of an abusive person could be really helpful. Unfortunately, there are faith leaders who sort of feel like, oh, I know what to do about domestic violence. That's just hitting and, tell the person this. So that's not too helpful, but it could be a fruitful time if you've already developed your ministry or the way that you deal with this problem. It's just, I would say that's not a majority of faith communities.
And I think, I'm sorry, but it's just like, it is not addressed. And this has been my lifelong struggle.
Yeah.
This is not something we do, I have been told. I have also been told that this is a place for spiritual practice and not any political agenda or a feminist agenda. I have been told and shut down multiple times in my lifetime. And I have always begged and pleaded, because there is this worship of the divine femininity in Hinduism. And it is the most appalling thing that, the very person who worships the goddess in the temple might go home and beat the partner, the spouse, into a pulp, so this dichotomy bothers me, has always bothered me, and it remains a challenge. And so, sometimes I have been told to keep my mouth shut and not bring up issues. I have been told I shouldn't make every spiritual space a political space. So I try to work my ways around it. I do my work insidiously. I reach out to people individually so that, we can create space for women who are hurting, both spiritually and, every other way. When you're a survivor of domestic violence, there is no end of your trauma. And the sad part of trauma is we can address it, but they never go away. They resurface at every time you get triggered by every incident that kind of threatens your safety, or even the idea that your safety can be threatened triggers most trauma survivors. And, sometimes we have complex trauma, family of origin trauma, exacerbated by the trauma that she has suffered at the hands of the batterer, and then also going to the temple or to the faith community not to find space because the batterer is very prominent over there, because the batterer holds power over there, because the batterer is the person who talks to the priest or who talks to the powers to be in the temples. So she doesn't feel that she has the right or the space or the voice to talk to many. I will say I have seen some changes, very minute changes. It is not something that makes me super happy. Some of the spiritual leaders have been talking briefly about domestic violence. It is just scratching the surface, but I have not really seen, unfortunately, any concerted effort to reach out to women in the congregation when this is happening, because I'm ashamed and I'm scared to say that this is not in their radar. This is not in their radar. Women and children, the plight of women and children, domestic violence is not in their radar. They're really busy praying for world peace and health and all kinds of stuff, which I am too. Don't get me wrong. We all need to survive. But, so there is very little space that is created for women survivors or children or whoever. So that is not being addressed in the way that should be addressed.
I think this is, it's a difficult time for the entire world, but I think it's also an opportunity. We're being tested for a reason, and all of humanity is being tested right now. So as we do a lot of reflection and prayers and ask for forgiveness, we can also use this time to, as Sally said, to address issues that have long been pushed under the rug or just maybe touched, on occasions. And I'll say this about our Muslim community: there are some leaders who talk about domestic violence, but they wait for a tragedy to happen. And part of the reason is the backlash on Muslims since 9/11, the Islamophobia is rooted so deeply in the American society that people are being forced to do that. You are on the defensive all the time. And so domestic violence then is an issue. I have been told many, many times that I'm doing our community a disservice by shining light on something negative when we had so much trouble already. Last January, a Pakistani woman was murdered by her husband, and everybody was out there trying to convince people that this is not what Islam says about the treatment of women. And so I spoke on a panel at the mosque where this young woman, she was in her 40s, left 4 children, was used to go. And I asked people if they knew that she was suffering, because this could not have happened overnight. There is a long history of suffering and abuse. The 18-year daughter was stabbed as well, but she survived. 4 children, and they were educated women in the mosque who said, we knew she was suffering, but we didn't think we could do anything because she was undocumented. Now, educated people who live in this city, they are professionals, and they don't know that being documented has nothing to do with you having the right to protect yourself and be protected if you are in a domestic violence situation, right? This is an opportunity to really talk about domestic violence openly and honestly. And I think one of the ways that our faith leaders can help us and people who are caught in the crosshairs of, of violence and being in homes where they're constantly living in fear, is drawing attention to the impact it's having on children. And one of the ways that I've seen that my discussions have been helpful is when I bring up the children. And I say, you have children of your own. Would you like your children to grow up like this? Or would you like them to be so traumatized that as adults they cannot function? And we know it's out there, the research is out there, that if a young boy is witnessing abuse at home and he's watching his father be abusive, 70% of the time he will grow up to be an abuser. And if a young girl is watching her mother be abused, there are 70% chances of her finding herself in an abusive relationship.
Because
If that is the ratio, then shouldn't be worrying about the younger people that are being raised in our homes, no matter what our faith background is, that it is incumbent upon us. It's not just restricted to the survivor herself. Why does ACS take this so seriously and encourages women to seek help? Is they're saying by not, and there she's being re-victimized. Talk of systems, right? She's being told that if you do not seek help, you are culpable. You are a partner in exposing your children to domestic violence. Now, what kind of justice is that? I don't know, when we don't have any resources or very few resources for these women, and how we supporting them. But, you know, I really think, and I would urge all faith leaders from all backgrounds to please use this opportunity. You're Zooming, you're conferencing, you're doing all of that, and people are sitting at home. They have the time to listen, right? They're not rushing to work or commuting or on subways or whatever. Everybody is at home. This is the time to talk about these serious things. So I hope that when this pandemic is over, that each one of us in clear conscience can say that we reflected and we have learned and we are trying to be better human beings that we have been in the past.
I thank you, Rubina. This is excellent. I really, really think that is how it should be, to be honest with you. I appreciate you saying that. I also think that all faith leaders, whether they're, doing a live telecast of their services or whatever have you, they can say a word. If you're feeling unsafe for whatever reason, please feel free to contact us. That should be said to people that, yes, if you call us, that will be held in confidence. Yes, you can safely call us and then we will try and help you as best as we possibly can. But that effort is not being made. Honestly, yes, we need to pray. Yes, we need to be safe. Yes, we have to do every single thing else. But, we all know that the pulpit is a very, very powerful place. Whatever is said from the pulpit is taken very, very seriously. So when we are doing all of these live telecasts of all these other functions and, sermons and this and that and the collective praying, why can't we speak up and why can't we address the vulnerable? Don't you think that it is also part of all our religious practices, irrespective of the background, to be of service to the vulnerable? I do not think there is one faith tradition that is going to disagree with me. And, why can't we just have one sentence after every sermon, that please reach out if you need help?
Well, one of the things that I want to caution all of us, and Sally, please jump in, is that not every faith leader is trained.
Exactly.
Has the expertise to respond to a domestic violence situation, right? Yeah. They are doing a lot of good work. I cannot claim to be an expert in everything else. I have experience in this field. I think what faith leaders can do is at least direct them to the right place, at least encourage them to seek help, right? They can listen to them, they can offer to pray for them, to be there spiritually for them, and if they're not trained in this field, to direct them to resources who can help them appropriately. It's hard enough for people like us to respond in a meaningful way, fully and completely. I cannot imagine people who are not trained in the area that can often give misleading advice that will put the woman in more danger, right? Often faith leaders have tried to get the couple to reconcile when there's evidence of physical abuse, which has actually endangered the children and the women. So I have some trepidation, but I would say that there are places, we may not be enough, but we are doing the work. And I think one of the biggest service we can do to our community is put the word out and say, here are the organizations that you can call. Here are the hotline numbers. There, there's a 24-hour hotline in New York City and nationally, so that they get, just like the mayor is reminding us to call 311, right? When we need the right information.
You're absolutely right, but I just feel like sometimes the faith leaders need to give the green light for the woman to kind of take the next step, because if they are not sounding if they are not giving out the permission that yes, it is okay for you to step outside, yes, it is okay for you to seek help. That's all we want, Rubina. You and I absolutely are completely aware of, like, misinformation can be absolutely lethal, but also at the same time, the green light has to be given by the ministers and not be told, oh, can you please pray on this and this is going to go away, or just be silent about the topic.
This is another example of, if you haven't done the work up to this time, because a survivor may hear a word from the pulpit, but if that faith community has not ever addressed it before, if there's going to be no trust there. So, I mean, an ideal situation would be if it was a faith community who did address this already, and it was a robust part of what they already did. And even in that case where we can't get to shelters, we can't find, there could be, if that was all set up with a domestic violence ministry, you could have someone, the pastor could say to me, Rabina's going to reach out to you. And that could just be a member of my church, it wouldn't necessarily mean she was calling about that, but those kinds of strategies, underground kind of strategies, shelter in place strategies, could only really be, implemented if you already had a consciousness about domestic violence. There are many people who will know somebody who's going through this or who suspects that, and they can also call those lines to talk things through, because for many people that their friend might be their only safety, and their friend might be able to help them safety plan in place in a way that they wouldn't be able if they can't reach out to anybody else. So there is safety planning that people do all the time. Survivors do it all the time in their home. They figure out where they're going to be safe, where the children should go if something happens. And this is what you need support on. And survivors need, if it's possible, to have one person they can talk to. And that person, if it's not an advocate, can call these lines and get some help also about how to deal with their friend or sister or something like that.
Well, Anindita, Sally, Rabina, thank you so much for joining us and talking with us today.
Thank you
very much, and I so appreciate each and every one of you.
It's wonderful to be with my sisters in the struggle.
Thanks for joining us for this episode of Interfaith Matters. Our guests have provided a number of resources to help survivors of domestic violence, as well as options for providing faith leaders with tools to effectively serve congregants in need. Those resources are available in our episode notes, but we want to mention here that anyone in need of help can contact the National Domestic Violence Hotline at 800-656-4673. New York City's 24-hour hotline is 800-621-HOPE. Interfaith Matters is hosted by me, co-producer AJ Debanis, engineered and edited by co-producer Michelle Polton-Simon, and executive produced by Kevin Childress. Learn more about us on our website. And again, thanks for listening.